This is CCTA case number 15. This is a 46-year-old man who has an abnormal electrocardiogram. There are 3 separate phases presented. These can be changed by moving the next button on the CCTA control. Let's start by looking at a general inspection. The aortic root appears to be of normal size. As we proceed caudad, we begin to see the origin of the right coronary far cephalad to where we might normally see the origin of the left main. So this is very common in a situation of congenital coronary anomalies, and you can see here that there is a separate ostium and then there is a separate vessel coming off here, passing anterior to the pulmonary artery and then proceeding in a normal anatomic course for what would be considered the mid and distal left anterior descending coronary artery. Get back to the origin here. We can take a look at the right coronary. This vessel appears to be quite normal. They need to change phase a little bit more to get a little better view of the right coronary. But this vessel otherwise is normal, has a normal anatomic course. Let's look at the left main. As we proceed up, we can see a little bit of calcification involving the aortic valve, aortic subaortic area of the outflow tract. But let's begin by looking at the left main artery. The left main takes off a little bit anterior compared to a normal situation, but otherwise is unremarkable. You can see that there is a what appears to be probably functioning as a first diagonal branch coming off here, but there is a small proximal and mid LAD, and as we proceed down distally into that view, we can see the aberrant vessel coming down and supplying the remainder of the otherwise normal anatomic distribution of the left anterior descending. Circumflex, take a look at that. That comes off in a usual manner as small non-dominant vessel. We can take a better look at the congenital coronary anomaly. What I've done here is basically done some 3-dimensional sculpting, and here is a view showing the takeoff of the right coronary artery and the left anterior descending artery as it proceeds down distally into the normal distribution. You can see the very small thread-like issue of the otherwise what would be considered anatomically normal situation. Since this passes anterior to the pulmonary artery, this is considered to be an anatomically benign situation. This patient needs no further workup.